Hi, today we're going to go over how to care for your Foley catheter at home. First, I want to show you what is included in the kit that you will receive prior to discharge. You will receive a large urinary catheter bag. You will also be receiving an optional leg bag, extension tubing that goes along with that leg bag. Your nurse will cut this prior to discharge as this is customizable to each patient. You will also receive a leg strap, a funnel, distilled white vinegar, med cups, plenty of alcohol swabs, a graduated cylinder, a basin, and written instructions of how to go home with your catheter. Next, I want to discuss the difference between the two bags and some important things to remember when going home with your catheter. This right here is the large urinary drainage bag. This is the only one that should be used at nighttime. It can hold a large amount of urine, and you will attach it to your leg using the leg strap shown here. When you are using the leg strap, please make sure that you are switching which leg you put it on every other day. Next is the leg bag here. Note that this bag is optional as it only holds a small amount of urine, and some people may find it difficult to switch between the bags. Also note that it should not be used at nighttime. This bag here also comes with leg straps attached to it. If you do use this bag, please be sure that you are switching which leg it goes on every other day to prevent skin breakdown. Anytime you are going to touch your catheter, make sure you are washing your hands with soap and water. Keep your Foley bag below the level of your bladder at all times. This is about hip level. This will prevent backflow of urine into the bladder. If urine does backflow into the bladder, this could cause a urinary tract infection. To go along with this, do not let your Foley bag touch the floor. We provide this basin for you so that you can put your catheter in it, or you can also put it on a low table, chair, or anything else that is below your bladder. Please make sure that you are emptying your bag every couple of hours, and just make sure that it does not get above 2/3 of the way full. Now we will go over how to change out the drainage bags. The first step is to wash your hands with soap and water. Next, gather all of your supplies. You will need a new drainage bag, some alcohol swabs that were provided upon discharge, and a towel of some sort, as there could be some urine leakage. Both of the drainage bags come with a blue cap attached that you can see here. Keep these caps as you will use it to cover the tubing back up when they're not in use. After removing the cap, cleanse the end of the tubing with alcohol. Next, you want to put the towel underneath where the Foley and the plastic tubing meet. After your new tubing is cleaned with alcohol, you want to have the patient pinch about right here to prevent any urine leakage that might happen. Next, you will carefully disconnect the old tubing and reconnect the new tubing. Be sure that you don't put it all the way to this line here, as it could be really hard to unattach it. We will now be cleaning out the urinary catheter bag. The bag should be cleaned about once a day. You want to gather all of your supplies. For the large bag, you want 32 ounces of warm water, 2 ounces of the white vinegar that was supplied to you, and the funnel. You want to pour the vinegar into the warm water using the funnel. attach it to the end of the tubing. It would be best to do this in a bathroom setting, probably a bathtub or over a toilet. Next, you take your solution and you pour it into the bag. Once you have poured all of your solution into the bag, it will be in the plastic meter. You want to tip it back so that it gets into the actual bag. The next step is to swish it around. And then you want to empty it. In order to empty it, you pull the clamp out, hold it over the toilet or a basin, slide it over, and make sure that you re-clamp it when you are done. You may shower with the catheter in. You can leave the bag off entirely and just let the urine drain. Just be sure to clean the end of the tubing with alcohol before reattaching. Be sure to drink plenty of fluids if you notice your urine is becoming dark or bloody. Please call your urologist if you notice a decrease in urine output. Just make sure that there are no kinks in the tubing. If the catheter comes out, there is leakage around the catheter, you develop a fever, or if you have any other questions or concerns.